So this is our eighth professional webinar session. We're talking about speech pathology. We've got Brother Waleed Shah from Adelaide. Jazakallah, Brother Waleed, for joining us and sharing your experience today.
Wa alaikum assalam wa rahmatullah. Jazakallah for having me.
All right. So a bit of background, Brother Waleed. I know you from before, obviously being in Adelaide, but sometimes we never talk about, backgrounds and things. So do you mind sharing, your background when you came to Australia? What kind of education have you had and jobs have you had before kind of starting your speech pathology journey?
All right. So I moved to Australia in 2010, very early 2010. Before that, I was in Pakistan. I was born and raised in Rabah. So I did my high schooling from Rabah Nusrat Jahan Academy. I finished year 12. Year 12 did not have super good grades, just average grades in year 12. And then with that, I moved here to Adelaide in 2010, and I wasn't sure about how to go about joining a university. So I had to sort of look at different avenues of getting into different pathways. I looked around, asked around in the Jamaat, and there had been no one before in Adelaide Jamaat who had moved to Australia in similar circumstances as me. So because of that, I ended up actually going back to year 11 because in Australia, SACE is 11 and 12. So they told me that you can't go straight to uni. You have to do year 11 and 12 again. So I started going to like a senior school in year 11, did a whole year of year 11 again. But towards the very end of it, one of the teachers, just like this, she was having a conversation with me one day and she was looking at my grades and she's like, "You're often not paying attention in class, but you do okay in the assessment. So are you familiar with this content? Why is it that you're not paying attention, but yet you managed to do okay in the exams?" And I told her that I've done this chemistry and physics before. I've done the same biology before. So then she told me about the STAT test, which is a South Australian tertiary admission test. It doesn't have any prerequisite. Anybody can do it. They don't even ask you for your year 10 or year 12 certificate. It's a literacy and numeracy test that if you get good grades on it, and it's also a percentile rank. So you don't actually get grades in the test, you just get ranked between the people that are applying that year. And there are certain courses in every university in which where if you fall in the top 20 percentile of that year, then you're guaranteed a score into that. Since then, universities have also introduced other courses that you can do with them directly and join university there now, but they didn't exist back in my time. So because of that test, I got into Flinders University into a Bachelor of Medical Science program.
Oh, awesome. So you didn't need to do year 12. It kind of bypassed that.
Yeah. So I bypassed that, and I technically I just spent an extra year in year 11. If anything, it just helped me revisit some of the very basic sciences again and get a bit of a better work ethic, which I lacked before coming to Australia. So like this time around, because I was having to do it again, I felt that I was a lot more focused. I knew what I was doing and why I was doing it. And I slightly understood the importance of it more than back when I was in Pakistan.
Okay, that's actually quite interesting. Sorry, I just want to diverge here a little bit. I want to ask you a little bit more about this test and what are the other degrees you're saying universities offer now for people who have graduated overseas. So it's a test that is it easy to do? Can you prepare for it? Because I know a lot of our brothers that come after year 12 from Pakistan.
Just basically just literacy and numeracy. So graphs, basic English tenses, so grammatical questions, very simple sort of numbers, addition, subtraction, division, and they're all scenario-based questions. So, but it's very very basic level maths and English.
Okay. So pretty doable. So that's a good learning point here. This is something I didn't know about at all. I know I've been asked this before, where people have done year 11 and 12 there, and it doesn't get recognized here. And so they can just say that. Is it called? Did you say SAT?
That
SSAT?
test in South Australia, so South Australian Tertiary Admission Test, it's called. But
Yeah.
my understanding is that every state will have something similar
Yeah.
with a
Similar.
different name.
Yeah.
Yeah.
Okay. And what are the
You
other
can also,
university
some
courses?
universities offer workshops for it as well. So if you're
Yeah.
not too sure, you can order some test booklets, and you can also go to. I remember going to University of South Australia to attend a session which lasted for 2 hours, in which they just
Yeah.
tell you about how to apply and how to do good in that test.
That's awesome. And what are the other courses you were mentioning where universities offer? Is it just like a kind of like a pathway degrees to start a degree, or like a diploma
No,
or
so these
certificate
are
course?
called. I've been thinking about the name of it. So I have recommended that as well
Mhm.
to a lot of people. It's basically like a
Pathway
university
program.
preparatory pathway program. So it goes on for 1 semester, and
Okay.
it again just manages basic English and maths. But you actually get assignments that you have to work on,
Mm-hmm.
and so it's called like a preparatory university course. And then at the
Okay.
end of it, you have some assignments and some exams. And if you do well in them, again, depending on the rank you have a list. Every university issues a list of courses. If you
Mm-hmm.
do well in that pathway program, then you're guaranteed admission
Mm.
into those courses.
Mm. Okay. Awesome. That's great. So then you did your bachelor's of medical sciences. Um, Tell us a little bit about that degree. Is that a degree that's worth doing in the sense that does it land you anywhere in specific? Are you, kind of job ready, or would you have, in retrospect, wanted to do a different degree that maybe lands you in a career, or you can do a job, or something like that?
If I was starting over
Yeah.
and still wanting to become a space pathologist, I will
Mm.
do a bachelor's in space pathology, which is a 4 year
Okay.
degree, and
Mm-hmm.
it gives you essentially the same qualifications that I now have with a master's degree.
Mm.
Um,
Okay.
there's very minimal pay difference as a new graduate,
Mm-hmm.
and it allows you to do everything that somebody with a master's can do, apart from working in the US. So if somebody wants to
Oh.
eventually work in the US, they will need to have a master's degree. But
Mm-hmm.
other than that, most of the European countries, New Zealand, they have an agreement with Australia where if you graduate here with a bachelor's, it allows you to perform the same tasks in those countries as well. So the opportunities are quite good. Similarly,
That's
a lot of
awesome.
the UAE, Middle Eastern countries recognize the bachelor's degree as well.
Yeah.
When I was doing my undergraduate, my goal was just one goal. I wanted to go to university. I had no idea what I wanted to study. My
Yeah.
parents just said, you have to study. So I just wanted to. And since after doing year 12 again, I was enjoying it a little bit as well. So I just
Yeah.
knew that I need to get somewhere. I just had no idea where.
Yeah.
So
Yeah.
the only reason I ended up in a Bachelor of Medical Science is like, initially everybody from there either wants to become a doctor or an engineer. So Bachelor
Yeah.
of Medical Science is actually a pathway medicine degree.
Yeah. Yeah.
In even to be more specific, it's a pathway medicine degree for people that study at
Mhm.
Flinders University.
Yeah. Yeah.
Right. So the Flinders University MD program has to take 20 students from their Bachelor of Medical Science program every year. So they have created their
Reserve
own
quota system.
pathway, yeah, which serves as a pathway. So as soon as I started, I quickly realized that everybody that was studying with me wanted to become
Wanted
a
to.
doctor.
There's more people who
So
wanted to be a doctor than you
yeah.
thought.
Right, so everybody wanted to become a doctor, and the degree by itself is only a pathway degree. It has very limited application in real life, but
Yeah.
I know 3 people from my cohort that
Mm.
ended up going into research, and they ended up doing a PhD straight away. They did honors as a bachelor's, but that essentially can be done with any degree, right?
Any degree. Yeah.
If you're the research type of person, you can literally turn any degree into a honors degree.
Yeah.
by doing an extra year of research, and then from there you complete your postdoctorate education, and then the prospects become really good. But by
Yeah.
itself, just with a Bachelor of Medical Science, the job applications are no different than somebody with a generic science degree.
Yeah. Yeah. Now that's
Yeah.
very good information. I think that's what I was getting at. Is like since doing myself a bachelor's in science back in the day, and I guess a diploma prior, I always when someone asks me for advice, I always tell them to do a degree that will make them either job ready or they'll have some specific kind of skill at the end of it, rather than doing a generic science degree. Because if they want to do medicine later or whatever later, they can still do it with a degree that, let's say, bachelor's in radiography or whatever. But at the end of the bachelor's of radiography, they'll still have a job, right? So for you,
I
the reason,
100% agree with, and I tell people the same thing. I tell
yeah,
people that a bachelor in nursing is
is
more
better than
relevant
bachelor's, right?
to medicine
Yeah, yeah, hundred
and
percent.
better than a generic science degree. It's actually you can get better grades in that as well. So to maintain a
Mm,
better GPA, because and also
yeah,
like at the end of the day, nursing is a field. It has so much opportunity
yeah,
for
yeah,
development and career development, and it
yeah,
lands you a job straight away, right?
absolutely.
So if I was to consider doing a pathway degree for medicine, I'd definitely consider nursing.
100%. Like, obviously done MD myself, and a lot of my colleagues, they were, not only they were paramedic, they're nurses. Obviously, there was some, there was a couple of optometrists. There was, occupational therapists as well, and even just other professions, engineers, commerce, law, everyone. So I'd rather, like you were saying, if I was to do it again, I'd probably want to do a degree that I was kind of job ready afterwards. But anyways, this
Absolutely.
this session is not about me, it's about you. So let's just keep on going. So then, at what point did you decide you want to do speech pathology, and why?
So I ended up with a Bachelor of Medical Science. I ended up taking a double degree option. So at the end of my degree, I did an extra year, and I
Mhm.
graduated with two degrees in my bachelor. So I had a Bachelor of Medical Science and a Bachelor of Business Technology as well. So I had the
Awesome.
opportunity to do an exchange year in Japan. So I went to Japan and I did a whole year of new venture capitalist firm over there that I worked with. And they
Mhm.
were basically bringing technology from universities, from ideas of students, working on it and then refining it, and then trying to get investors for it so they can bring that idea into the market in the form of a product. So that gave me a really good exposure into like a mini corporate life, or what
Mhm.
that sort of job could lead to. And at the end of it,
Sorry, sorry, was that an exchange study program, or was that as a job
it
you
was a
went there to work?
exchange internship. It was a
Oh,
study,
as an
so I
internship.
was studying. It was worth four topics, but it was an internship. So I was not
Okay.
studying as such. I was working for a
Yeah.
firm, and at the same time I was submitting some weekly reflections, and I had to submit like a 2,000 page experience
Mhm.
essay at the end of it as well. So it was pretty
Mhm. Okay.
straightforward. And then
Okay.
obviously my supervisors had to rate my performance
Mark you
based
off on
on
that.
which the university was able
Yeah.
to grade me. Um, but
Okay.
yeah, so it gave me an opportunity to sort of
Mhm.
wear like nice clothes and go to an office and sit there all day, work on a
Mhm.
computer. And at the end of it, I realized that I still wanted to do something related to medicine, where it allowed me to be not quite a doctor, but like a medical professional,
Mhm.
which didn't involve sitting in front of a computer or a desk all day.
Mhm.
So
Mhm.
as soon as I came back from that, I started looking at different opportunities, and what masters could I study that was relevant to medical, but didn't require me to do any further bachelor level study.
Mhm.
Dietetics, you can do a master's in dietetics, but you need to have certain topics in your bachelor's. So I wasn't eligible for that. Occupational therapy is the same. Unless you've done a very selective set of topics, you can't just go into a master's. Then
Sorry, did you say
physiotherapy.
dietetics also need their bachelor's degree in the dietitian? Otherwise, you can't do a master's?
No, and as long as you've done some particular subjects that are directly relevant,
Okay.
then you can do a master's,
You
right?
can do master
But
in that.
yeah, I did not meet the prerequisites for any of those programs. So
Yeah.
my
Okay.
options at the end of it were audiology and
Okay.
speech pathology. These were the two areas where I was eligible. I had the GPA requirement met, and I
Mm-hmm.
had the prerequisite requirement met for these two programs,
Mm-hmm.
because basically both speech pathology and audiology just require you to have a bachelor's degree. There's no prerequisites.
Okay.
Okay,
Yeah.
you need to have a GPA of 5. As long as your average GPA is 5 in your prior study, you're eligible to apply for the masters of these both of these degrees. At
Okay.
that
Yeah.
time, the only universities that were offering this program was Flinders University.
Mhm.
Flinders
In
University in
in in
Adelaide
South
is
Australia.
in South Australia. Flinders is still the only university that is offering a postgraduate program in these studies. The other universities have undergraduate programs, but Flinders is the only one with a postgraduate program.
Sorry,
Um,
Flinders in South Australia, right? Other states have
in
their
South
own
Australia.
that they offer.
Other
Yeah.
states also have only one or two universities that have a postgraduate program. So, if you're wanting to study speech pathology as a postgrad degree, your options will be fairly limited, even in your state.
Okay.
Um, so then, yeah, I applied. I looked into it a little bit. I spoke to some speech pathologists that I could find in my area. I remember walking into a practice one day, just, like to have a chat with the speech pathologist there to get an idea about what the degree offers, or what the job of a speech pathologist looks like. And most of the things I found interesting. I looked up some online information about
Mm,
the role of a speech pathologist in a hospital setting, because
mm,
eventually that was my goal. That's where I wanted to end up. And
mhm.
I really liked the idea that so it would still allow me to work in a hospital as a health professional, um, which was something that I really wanted to do. So that's why I ended up applying for the master's program.
Perfect. How's the studies like? It's obviously 2 years of masters. Did you manage? Can people manage to work alongside it, or is it really time demanding?
I happen to have I have worked throughout my studies. So all four
Yeah.
years of bachelor's and 2 years of masters, I was working
Yeah.
throughout. But Alhamdulillah, in God's grace, I always had employers that were very understanding of my study requirements, and
Yeah.
I was always very upfront with them as well about
Yeah.
the long-term goal that I had. So they hired me knowing that I was a student studying at a
Mm,
university.
mm,
So
mm.
I was able to, during the masters, the program is very hectic. So essentially, they squeeze 4 years worth of knowledge in 2 years.
Mm,
Um, and this is, we're talking about 2017 and 18. So
mm.
online study was a lot less than it is now.
Yeah.
A
Yeah.
lot of study I did was face-to-face contact
Mm,
hours. We
mm.
had the opportunity to listen to lectures online, but we were required to be there as well in person. So
Yeah.
we were at university 5 days a week. We did not get a summer holiday or a mid-semester break. We only
Oh
had,
wow.
I think, every year we only had 2 weeks of holidays
Mm,
towards the end of the year when the semester ended. And even in the end of year holiday, we would have to do placements and things like that to make sure we finish within the 2 years, instead of um,
mm,
uh, being finished with the degree but still needing to do some placement hours. So
mm,
it was pretty full on, but I could manage to work 2 days a week.
mm,
um, Eventually I even dropped the job that I was doing, and I started
mm,
driving Uber, just
mm,
because it was a little bit more flexible and allowed me
mm,
to
mm,
sort of set my own hours, and I could work
mm,
whenever
mm,
I had time. I could work
mm.
more in the holidays.
Yeah.
So that's what I had to do in my final year.
So it is 5 days of uni from for masters. You didn't have days off.
Yeah, so 5 days. there was some contact every day. So some days were not as busy,
It wasn't full
but
day,
some
yeah.
days, there was at least 2 to 3 hours of content given to you almost every day. Then there
Okay.
were
But
tutorials,
maybe now
workshops.
with COVID, after COVID, do you reckon it's possibly changed a little bit where you can do things a bit more flexibly?
I'm actually still very closely involved with the university. I have students that come to me with placement, so I'm quite
Yeah.
sort of well up to date with
Aware.
how it is
Yeah.
now. It's a lot different now, so it's
Okay.
there's very minimal contact involved, but that
Okay.
doesn't mean that the study is any less. You still have to
Yeah.
work just as much. You can just do it from home.
A
You
little
you
bit, or
still have to
maybe
go
at your own
through,
time.
yeah, in your
Yeah.
own time, and you can you
Yeah.
can you can divide it a little bit more. Yeah. Yeah.
Yeah, and I think most degrees have kind of adopted that a little bit because it's kind of less expensive for the universities to have lecturers when they can have a lecturer record a lecture once and just keep on giving students access. So that's something that's changed since COVID, and
Absolutely.
I'm kind
So
of
yeah,
experiencing it a little bit.
when I run tutorials for Flinders, for example, we used to have a tutorial every 7 students. Now
Mm,
we have a tutor. Now, when I'm a tutor, I'm tutoring 7 rooms of students at the same
mm,
time.
mm,
So it's much different. So I sit in front of a computer now, and they link in with me on a computer, and we can just
mm,
all go through. And some of them are there physically, but a lot of the
mm.
students are just at their homes, logging
Yeah.
in from there.
Yeah, yeah, cool. All right. So you then did your degree. It was 2 years, quite full on, relatively full on compared to I think other degrees. And then after that, tell us your experience after that. Do you have to do internship? Can you land a job straight away? Is it hard to find jobs? Do you have to move states, i.e., Tassie?
All right. So as soon as you graduate as a speech pathologist, there are a lot of jobs out there. It's
Okay.
more about what type of the scope of practice of a speech pathologist is huge.
Mm-hmm.
You can do so much. So as a graduate that was wanting to work in a hospital, the hospital jobs are very competitive. Okay, so
Mm-hmm.
in every state, all the public hospitals, they don't hire a lot. They only hire once or twice every year, and
Okay.
they release those positions as a new grad positions, right? So those positions are very competitive. I'm not exactly sure why they're not the highest paying positions. It's just
Mm-hmm.
that there is a unspoken prestige associated to them by the people that apply for them, and
Mm-hmm.
that's why they're very sought after. And because
Mm-hmm.
there's less of them, the competition is very tough. Um,
Mm-hmm.
but that doesn't mean that there's not jobs out there. The biggest employer in every state is now NDIS. Back in the day, it
Mm-hmm.
used to be the
Mm-hmm.
Department of Education. So
Okay.
Department of Education hires at least 25 speech pathologists every year in South Australia. The number would be much higher in Melbourne or
Other
Sydney,
states, yeah.
New South Wales or Victoria, because there's the departments there are much bigger. Similarly, in
Mm-hmm.
Queensland, it would be much higher. Now, with the whole industry has completely transformed with
Mm-hmm.
NDIS, and so the jobs are there. Like there's so many jobs out there that any graduate will not have a problem finding work, but
Okay.
more so if it's when you're looking for a job, you should be looking for an established company. You should be in your interview asking for things like who will be mentoring you, what sort of experience that they will have, so that they can make you a good clinician. They can pass on those skills to you.
Mm-hmm.
Unfortunately, with all these companies popping up, the salaries have gone up, the jobs have gone up, but the quality has gone down
Mm-hmm.
because 2 years out, graduates are calling themselves senior speech pathologists, and that is the problem. So when I graduated, I got offered positions almost every week, but they were not in the area where I was trying to apply for.
Mm-hmm.
Smaller private practices were very keen to offer a position very
Mm-hmm.
quickly, but the public hospitals, they had longer waiting periods after the interviews. They were maybe waiting for the top applicants to reply to them first and then
Mm-hmm.
going down. So I, uh, while waiting for one position, said no to the other position, then got denied the other position. So because of that, I think 2 months passed, and then I just, like, wanted a bit of change, and the Tasmania job had been offered to me already, and I had turned it down. But then one day I just said that maybe the change will be good for me. I had been there, me and my wife, we had both been to Tasmania. We
Mm,
really liked the island, and wanted to get a change as well from Adelaide. So we just
mhm,
decided to accept that opportunity and take it as an adventure.
mm,
So this organization that I applied for, it was a very well established organization in Tasmania that they've existed there for more than 50 years. Before they were government funded, so the name was different, but now they were
mhm,
coming under NDIS. So it was a pediatric disability organization, but
mhm,
a wealth of experience there. So some of the speech pathologists that I was working with, they were 20, 25 years out, had done all sorts of things. So they had a huge amount of knowledge that they were able to pass on to me, and I had
mm,
a really, really good time learning from them.
mm. Okay, so your first job opportunity, you kind of took the Tassie option. You went to Tassie, you worked there for a few years, and you kind of came back to Adelaide. And since then, I think you've been working with the hospital. How was the working in the community experience like? How versus the hospital? What's the main difference, and which one do you prefer more?
So initially working in a pediatric disability practice, I was really enjoying the work I was doing, but I had that thing in my mind that my goal was to work in a hospital, and that
Mm-hmm.
hadn't happened so far. So while I
Mm-hmm.
was in Tasmania, a job came up in the hospital there, the Royal Hobart Hospital. I
Mm-hmm.
applied for that. That was a new graduate position,
Mm-hmm.
and they gladly took me on board as a part-time therapist there. So that's where the hospital journey started. So I went part
Mm-hmm.
time at my first job within the
Mm-hmm.
first year.
Mm-hmm.
And for the rest of the 2 years I was there, I ended up working 3 days at the pediatric disability practice
Mm-hmm.
and 2 days in the adult acute wards of the hospital there.
Yeah.
Um, I really sort of enjoyed working with the children, but it was a lot more sort of effort that you need to sort of be prepared and need to get down with them on the ground, run after them, do whatever is the need of the child, and
Mm-hmm.
liaise with the parents, do a lot of assessments that are very different to each other. So it was quite full on in that space. Uh, a lot of report writing, a lot of keeping track with the rules of NDIS, a lot of travel. I got the opportunity to go to very remote parts of Hobart in the rural regions, into small schools, small communities, small community centers. So it was really, really good. But once I started working at the hospital in the stroke and neuro space, I really felt like that was something I was leaning towards a bit more. So I started giving that a bit more focus. And then based on that experience there, Flinders Hospital, which is the hospital affiliated with my university where I studied, they had a
Yeah.
position going on, which I applied for. So I then got that full time, and I
Yeah.
moved to Adelaide, back home. And from then on, I just continued to progress as a acute speech pathologist in a hospital setting. But as of lately, I've started going back towards the pediatric work that I was doing before as well. So since last year, I've been doing some private work again
Mm-hmm.
within the pediatric disability space.
Yeah. Awesome. So what you graduated 6 years ago now? Have you been working for
Yeah,
6 years or more? Yeah,
I've been
awesome.
working for 6 years.
Um,
This is the
yeah,
seventh year.
yeah, nice, awesome. All right. So in retrospect, having the experience in speech pathology that you have had and the degrees you've done, would you have done something differently now that obviously you know a little bit more about other allied health services and stuff like that to our audience, to our brothers still considering what to do? Would you do something differently? Would you do a different degree? Would you recommend them to do a different degree?
As a On an individual level, I personally feel very content with my decision of choosing this field.
Mhm,
I don't even feel like I chose it. I think it was more that Allah Ta'ala's guidance that landed me here. And I feel
mhm,
very privileged, very happy to be where I
Mhm.
am, and I would not trade this for anything else. If given the opportunity to start
Mhm.
over,
Mhm.
purely because especially in the last 2 years, with having the flexibility of starting a private practice on a small scale, I feel like I, at this age where I am with two young kids, I have the flexibility and the income that allows me to do a lot of things that I could not have done otherwise.
Mhm.
Um, and I think you can make space for these things regardless of what profession you're in. But Alhamdulillah, I
Mhm.
just feel like this stability that I have in my life, it doesn't allow me to sort of consider other options, and it just makes
Mhm.
me very content. And there's so much room for more growth if I work
Yeah.
harder, if I grow the practice that I've started, and there's so much more work that I can do. The other thing that I've really enjoyed in the last 3-4 years is that I 4 years ago I emailed a special school in Rabwa. I told them that I'm a speech pathologist, and
Mhm.
what I've been doing for the past few years. And since then, I've been in regular contact with them. They have more than 100 students that are studying there, and they
Mhm.
all have needs that are relevant to what I know and can help them with.
Mhm.
They have a student speech pathologist there that is studying right now, so I've been working with them, providing support to them. So inshallah, in future, when I'm a bit more financially stable, there is so much room for me to go over and help there as well.
That's awesome. That's very good to know. That's awesome, mashallah. That's exactly the answer I was after. So, um, I think dietitian. I just want to speak about it. I think what do you think about dietitian or other degrees that you were considering? Because some of the options are a little bit more saturated. I've heard a little bit about dietetics that there's less job opportunities, um, uh, and stuff like that. Have you heard anything similar? Obviously, considering it's also allied health, and you're in allied health kind of space.
So I do work very closely with dietetics. So when I'm
Yeah.
in community and then residential care space,
Yeah.
dietetics is very important there.
Yeah.
And then similarly, when I'm in the hospital, the dietetics team there is very important with
Mhm.
monitoring the feeds and the nutrition requirements of the
Mhm. Mhm.
patients there as well. I feel like any industry that cannot include NDIS at the moment, the community jobs are a lot less. But that doesn't
Mhm.
mean that anybody should be deterred
Mhm.
from joining that field. So there's a huge market for dietetics out there.
Okay.
There's some really good jobs. So a speech pathologist, occupational therapist, physiotherapist, podiatrist, they're all allied health. They're under
Mm.
the same employment bargaining agreement in the hospital, and their
Okay.
salary scales are no different. The competitiveness of it, if a hospital employs about 20 physiotherapists, they will have
Mm.
15 occupational therapists, 10 speech pathologists, and maybe 8 dietitians. So
Yeah.
yes, the jobs in some industries are a bit less, but the
Yeah.
careers are equally rewarding,
Yeah.
and the importance is no less.
Yeah.
The only thing is that if, for example, I don't know if some of our Lajna will ever listen to this or not, but if a
Yeah.
female is considering taking up something like speech pathology, occupational
Mm.
therapy, and
Mm.
physiotherapy, the private practice prospects are a lot more as opposed
Mm.
to in
Dietitian.
dietetics. But
Yeah.
still there is a market for it out there. Even in the NDIS space, dietetics is needed and exists. It's just a little bit more challenging to get in.
Yeah. That's very good information. Jazakallah for that. Yeah, we'll come to the private practice bit a little bit as well. But can you just give our audience a bit of a flavor of speech pathology? Like, what exactly is it that you do on a day-to-day basis? What kind of patients you have, and how you kind of assess them and manage them? Just on it as an just as an overview of the field.
So the scope of practice, as I said, is so big. So you can work with young children that are going to school, that have speech impediments, that have
Mm-hmm.
language delay, that have
Mm-hmm.
severe disabilities, and you need to provide them alternative methods of communication. It can be as
Okay.
simple as a yes no button, or a simple picture board where they can point and tell you what's going on, or it can be a very complex communication book, or it can be an app on the iPad which will allow them to communicate. All of this stuff is
Mm-hmm.
highly specialized. So in the ASD autism spectrum space, there's so much work that a speech pathologist can do with helping the child communicate their behavior, their needs, and their wants in a more regulated manner. And
Mm-hmm.
with better communication, the emotions can be a bit under control as well. Then, if you talk about adolescence, so like the in the space of child protection, or like the challenging behaviors in teens, again, stuttering can be a big issue in that age as well. So helping those people with better communication, people that have been through a lot of trauma that has affected their ability to talk. There's a lot of space in that. Like there's a court speech pathologist like that helps people before they have a court hearing, with helping them prepare for the conversation that's going to happen between the lawyers and them. So there's a lot
Wow.
of and advocates for the clients if they have any special communication needs, so they can then make the judge aware that this person is not able to express themselves as
Mm,
maybe as good as some other people. So the scope of practice is absolutely huge. There are some speech pathologists that work with people in accent reduction. So if somebody has a very strong accent, they can
mm,
help them reduce that. But in the hospital setting, so my majority experience has been with dysphagia. So even though it's called speech pathology, we also help people that are unable to swallow properly. So majority of the work that I do in the acute hospital is related to people swallowing. That can go wrong in so many scenarios, whether it be like a neurological event where they've had a stroke, whether they have a cancer in the brain, or somewhere along these areas where the muscles of swallowing are. So I work with those people. We assess them. We sometimes use specialized equipment like doing video fluoroscopy studies or fiber optic endoscopy studies, to look at their swallowing muscles and then suggest alternative diets and fluids, or suggest a rehab regime which needs to be followed, and then we assess them again after a certain time. Then similarly, with every hospital, there's a rehab attached. So the rehab has another team of about 20 speech pathologists that work on these conditions like post-stroke rehabilitation, or a post-severe fall, or a hemorrhage rehabilitation. Um,
mm,
then there are speech pathologists that exist in the community. So they work with these individuals with disability, as well
mhm,
as a big sector of the aging population in Australia, which is the
mm,
nursing home and people that are still living at their home, but they have
mm.
home care packages to support their needs.
Yeah.
And
Awesome.
then
Okay.
obviously I forgot about schools as well. So there's every
Mm.
school either employs a speech pathologist or has a visiting speech pathologist that looks
Wow.
at
Okay.
speech, language, as well as literacy of the children. So like even looking at things like spelling, or people that have dyslexia, or
Mm,
behaviors like ADHD, and how it's impacting their learning, and where
mhm.
they should be at a certain level. The speech pathologists that specialize in literacy will look at the literacy of children, and match it to where they should be according to their age, and then try and help them with the basic concepts of literacy to try and improve on those.
That's awesome. That's very good. Thanks for that. That was very, very comprehensive and very helpful, even for me to understand, despite knowing about speech pathologists for quite a bit. So you spoke about private work. Tell us a little bit more about that. How do you go about it? What I guess I guess the benefits it offers is like a bit more flexibility. It's a bit more better paid. So those are the highlights, I guess. But what are how do you kind of
I
go
think
about it?
once you've found an area, I recommend
Yeah.
everybody to get an employment with a good employer for at least 2 to 3 years after graduating, so they can get all the experience and expertise of the people that have worked in the field for a long time. And once you've gathered that and you feel confident, I want you to learn a little bit about business, about taxation, how that works, so you can set up a company. We are talking about an area that's a medical field, so the risk is very high if you get sued. So you need to sort out insurances, and you need to have good paperwork practices in place, so everything is documented, it's all legal, you have confidentiality that needs to be maintained. So make sure you understand all of this terminology before you venture out on your own. And if you feel like you're somebody that understands all of this, how money comes in, how you need to pay tax, you need to have a good accountant that advises you what is a private entity, what is a company, what's the difference between a trust and a company and an individual sole trader.
Mm,
Once you understand all of these terms, then you can register yourself either as a sole trader, speech pathologist, or as a company, and then start advertising your services. Any speech pathologist out there that claims to be able to do everything will not be a good speech pathologist. At some point in your career, you need to pick an area and then advance yourself in that area, because all of these fields are so different to each other that you can't just say that I can do everything.
mm,
um, you
mm,
might be able to do a little bit of everything, but
mm.
nobody can claim to be an expert in everything. So you
Yeah.
have to pick an area. Once you've picked an area, you're best to stick with that area and advertise. You make yourself known in that area. So once you've picked an area, advertise your services in it. Whether you do it online, learn a little bit about marketing. So once you've
Mm,
marketed your business, if during your career of 3 years you've built good relationships in the industry, you attend conferences, you go to your local body meetings, you'll have so many contacts to start off with. So you can let them know that you've started a practice. If you have a strong LinkedIn, you can post about it there. And then people just start recommending you. You can also, before going out completely out on your own, there are a lot of practices that allow you to subcontract with them as well. So instead of asking them for a job, you can take work from them as a contractor, for which they
mm,
will pay you per client, not as a salary, not per hour. And some of those options are financially quite viable as well.
mm,
Even though I've been doing my own work, I still subcontract with a very good friend and colleague of mine. So she has a very successful practice. So she's always
mm,
happy to lend me some work if she's got more than what she can do herself.
mm,
So I
mm,
just work with her, and then I make an invoice to her, and then she pays me for my services.
mm.
S-
Very good.
So it's a very casual agreement where she doesn't
Mm.
have to give me work, and if she has
Yeah.
work, I don't have to say yes to it. But it
Yeah.
works quite well because the
Yeah.
flexibility is quite high.
That's awesome. All right. So now speaking about the money side of things, as a new graduate, what kind of money can someone expect, and how does it keep going up? And what are the, I guess, levels of it? Like, do you, every year do you become? Is there like
So
a set
in the
way that
hospital
you're becoming like a
system,
professional?
yeah, in every state, you once you graduate, you get classified as an allied health professional. So your
Hmm.
levels are AHP. They're called AHP, and you start at a
Okay.
level one.
Okay.
There are four levels, so HP 1, 2, and 3, and every
Hmm.
level has a five levels. So 1.2, 1.3, 1.4,
Oh, okay.
1.5, then
Right.
2.1, 2.2, 2.3,
Mm-hmm.
2.4, 2.5, and so on.
Mm-hmm.
A senior speech pathologist in the government is a level 3, and a manager
Okay.
is a level 4. So 3 and
Oh,
4 are not for everyone to get there.
mm-hmm.
Very few people get to 3, and then from there, only one or two get to 4, because like my manager in my department is a level 4, but we have
Mm-hmm.
3 that are AHP 3s. Um,
Mm-hmm.
in the increment of every position. So when you start as a new graduate, if you're master's, you'll be 1.2. If you're a bachelor's, you'll be 1.1.
Mm-hmm.
Every year, you're guaranteed an increment. So every year,
Okay.
you'll go from 1.1 to 1.2 to 1.3 until you get to the end of your level. So once you get to 1.5, you will have to then apply for a level 2 position. You can't
Oh,
just
okay.
automatically become a level 2. And then once you
Okay.
get to 2.5, you will then need to apply for a level 3 position. You can't automatically get to a level 3 position.
Oh, okay. Sure.
So
Sure.
The salaries at present are starting at about 67,000 for a HP 1.1, and going up to 120 for a level 4.
Okay. Okay.
Realistically, so if I am a level 2.2, if I was working full time at the hospital, my annual salary would expect it to be about 89 to 90,000 at this stage.
At
Um,
2.2, as a 2.2.
as a 2.2, and this has gone up in the last 2 years because they had a change in the employment bargaining
Yeah.
agreement.
Yeah.
So it
Yeah.
used to be much less before that, right?
Okay.
At this stage, you'd be expecting to make close to 90 at
Yeah.
level mid-level 2, and you're expected to start at about 70, like let's just say close to 70, 67.
And that's before penalties and stuff. Do you have penalties, or do you like? Is
The
that
only
pretty much like
penalties,
standard
so
limit?
as a speech pathologist, you rarely work overtime in the public
Yeah.
system, and even in
Yeah.
the any private practice. Like
Yeah.
there's no overtime. You can't do
Yeah.
evening shifts. It's a majority
Yeah.
9 to 5
95.
work,
Yeah.
but there are weekends involved. So if you're working
Yeah.
on a
So
weekend,
sometimes
you'd then be getting penalty rates for the weekend work.
it should make it a little bit different, but not too vastly different. And obviously, is private work, once you grow that, a very good way of kind of increasing that, or is that still kind of marginally stays around the 120, 130 mark?
No, with
Is
private
that
work,
vastly different? Do you get vastly paid better, or is that very marginally different?
so private is very person dependent. So you can make a lot more in private work, but
Yeah.
then that's just like saying that you can make a lot of money in sales. Everyone cannot be a
Yeah.
good salesperson, right? So it
Yeah.
just
Yeah.
depends on how you're
Okay.
advertising yourself, how you're
Yeah.
scheduling your day, how good you are, so that people are sticking with you and consistently coming back to you. But on an average, like if you have a good client base, you'd be easily touching the 140 mark in private work.
If you're doing
Um,
full time
um,
private.
if you're doing full-time private work and you have good accountants that are able to sort of, because at the end of the day, when you're making 140, the taxation is a lot different as well, right?
Yeah.
So um,
Yeah.
for you to be able to match the take-home salary of somebody that's employed with the government in
Yeah.
private business, you'd have to sort of look at your taxation and then see what your take-home pay is as compared to somebody who's working as an employee.
Yeah. Yeah.
Also, when you're doing your own work, a lot of the perks cannot be called your salary, right? For example,
Yeah.
you can include some of your daily expenses into your business. Like I use a phone when I was working for the hospital, my phone was my responsibility. But
Yeah.
now, because I use the same phone for my business purposes, now it's
Yeah.
a business expense. Same with
Yeah.
my
Yeah.
car. When I use my
Yeah.
car for my business, it becomes an expense, not an asset.
Yeah.
So that terminology is different. So with that, those perks, business ends up being better. But if you
Mm.
want to put a number on it, it might not be
Yeah.
like a significantly higher number, but you'd
Yeah.
be a lot more comfortable
Yeah.
doing private work. Yeah.
Yeah. Awesome. All right. That's very good to hear. That's very, very comprehensive. Jazakallah for that. Very insightful. Any words of advice for, let's say, high school students? Is other ways they can try out if this field is right for them? Or just otherwise, what would you say to the
I
audience?
highly encourage people to consider this field if this is they've achieved, like if somebody's finishing year 12, the ATAR in the last few years has gone up significantly. So you need good grades in year 12 to be able to be eligible for a Bachelor of Speech Pathology.
Roughly,
It's
what
a
are we talking?
female.
Roughly, what kind of grades? What
We're
ATAR
talking
roughly?
above 90. So it's
Above
looking
90.
at
Okay.
93, 94. Yeah, 94
Okay.
I
Yeah.
think was the cutoff last year for Flinders.
Okay.
So you need a significantly good ATAR, not as good as you would need for medicine, but still, 94
Yeah.
is a good number, and not a very easy number to achieve for everyone. So you have to pay focus and make sure you give your best in your 12 exams. And if you have achieved the ATAR, one thing I do want to mention, I forgot to mention it before, it's a very female dominant field. So I think
Really?
only 3% of speech pathologists in Australia are male.
Ah.
But as a male, you get a competitive advantage. You know, there are so many families of young children out there where the children work a lot better with men, but there are no male speech pathologists out there. And similarly, even in
Oh,
a
okay.
hospital setting, they just don't have any males. So I'm the first male to work in Flinders Hospital in the last, I think, 20 years, right?
No
So
way. Is that
yeah,
is that a thing?
yeah.
Wow, I did not know
And
that. So it's
when I
pretty
was in
similar to
yeah, when I
nursing, huh?
was
It's
in
very female
Tasmania,
dominated.
allied health in general, even nursing is very female dominant.
And
My
you see,
first
I see a
job
lot of like I see a lot of physiotherapists, male physiotherapists, and yeah,
there,
occupational
I
therapy is
mean,
predominantly women
there
as
is a
well.
lot of them, but there's still
Yeah,
it's a female
it's like
dominant industry. But speech pathologies and dietetics more so.
even more
So
so.
like in my whole
Yeah.
cohort at uni, there were two of us only. Um, and in the bachelor's in the same year, there was 80 enrollments and only two male as well. So at my
Wow.
first job in Hobart, we had a department of 50 people, and I was the only guy there as well.
Mm.
Um,
So
so it's a very female,
just by virtue of graduating, you're in the top 3% male
that's right.
category,
That's right.
just because
That's
you are
right.
the 3%. Yeah, that's
You
awesome.
are among the top tier people.
Yeah.
Um, and there's
Yeah.
a huge need for men out there. So, like as a male in the industry, you get treated like royalty a little bit. So, you know,
Mm.
they value you and they encourage men to apply. They're always encouraging male students to study the course as well. So, I mean, I highly recommend it. It's a very satisfying career, and unless you're looking to make like a ridiculous amount of money in other like finance industries and stuff, like in terms of a health profession, this is very rewarding. And Jamaat can also, I'm sure in the future, can use you in so many ways. There's
Yeah.
such a need out there in Rava right now as well. Like when I speak to the school there, they're desperate
Mm.
for people to come over and help. So
Mm.
I think the more we have, the better.
That's awesome. Yeah. And, like the long-term effect you can have on someone's life would be life-changing, like these are the things like you're talking about kids that are not getting that specific care that if they were to get in the long run, that would change their life in so many ways.
Just like any health profession, it's khidmat e
Mm.
khalq along with a job. So, you know, like every day you're helping people. I worked at the local hospital, so a lot of the people from our Jamaat, when they're there, I get to go see them, and then I can take the visiting the sick for condolences
You get your Khuddam report done
on
along
my
the way.
report as well. So, you know, like and you
That's
can
a plus
also
we wouldn't
give
have
good
thought about
advice
before.
to people just about
Yeah.
navigating the health system,
Mm.
because a lot of people that are not involved in a hospital scenario, they don't understand how things work and what
Yeah.
things they're eligible for, what avenues they should use. So it makes you a very well-rounded individual. That is,
Mm.
you get a lot of respect. Every time I've told somebody that I'm a speech pathologist, I have
Yeah.
always gotten good questions from them about their kids, about their fathers or grandfathers, or
Mm.
like, I've
Mm.
experienced this issue. Can you help me? So people look at you for advice. People look at for you for guidance, and
Yeah.
it's a privilege to be in that position where
It's a
you can help someone
reputable
or guide someone.
reputable profession in that way. I agree.
Definitely.
That's awesome, brother. Mashallah. Lovely to hear about your journey. Mashallah, you had a crazy run, with doing, navigating yourself and ending up where you've, mashallah, ended up. So Jazakallah also for your time and sharing quite in depth, deeply even your personal experiences and stuff like that. So we really, really do appreciate that. And inshallah, I'm sure a lot of our Khuddam brothers and even when sisters, because this will be up on YouTube for people to listen and benefit from. So inshallah, they'll be able to benefit for many years to come. So appreciate your time.
Jazakallah Hadi. Really
Jazakallah.
appreciate your time as well. Thank you. Take care.
All right,
Assalamu
brother.
alaikum.
Assalamu alaikum wa rahmatullahi wa
Hafiz.
barakatuh.